am Aishwarya Rathore. I got 49th rank in AIIMS exam May 2018. I am an undergraduate of AIIMS New Delhi. I finished my internship in December 2017 and I took the exam in November and then this time again. So I'll guide you a little regarding how I can help with your preparation if you're preparing for this exam. First of all, we'll start with how did I prepare in my internship and the 6 months post internship. In my internship, contrary to what other people think, it is necessary to attend your internship up to a limit, because in AIIMS exam there are a lot of questions which are based on practical knowledge, which are based on things which you've seen in OTs, things which you've attended based on cannulas, some of which you can still find it in theory, but it's easier if you have attended certain postings. So please don't be like internship you're not going at all and just staying in your room and studying. You need to attend it a little and definitely make a schedule while you're studying. If it helps, then you can study the subject along with the posting that you're attending, which will make it easier. You will be able to find and corroborate the findings in the posting which you are able to study at your room. So that would help. And another thing is that it's not necessary to attempt the exam and get a successful rank in your internship itself. That is technically your 0th try. The first try is after your internship is over. So obviously you need to prepare and you need to try to take and attempt the exam in your internship itself. But don't be disheartened if in your internship you are not able to do well, because your May is the best attempt. And even preparing for your NEET, that even if you have to prepare, it's alright. In 6 months post internship, when your internship is over, now you're done with everything, all you have to do is study. You can take either of the two approaches, coaching and TND based approach or self-study based approach. Either way, self-study has to be a part of your routine, and please have some consistency. Do not spend a single day where you've not even studied for 2 hours a day. There are certain days where you might be ill, where your mood is not correct, where you have to go somewhere, where you're busy with something. It's fine, it's not a problem, but you should not let a day go where you've not studied at least a bit or a topic or certain questions. Regarding the strategy in internship, obviously you study the subject. Since if you're in your internship and you must have studied the textbooks in your 5 years, so in your internship it's better to do it in a concise manner. So you can use review books, whichever review books you prefer or you've been advised for, you can use that. And post in the 6 months, you revise them again, or you do certain topics which you know are important, and but do not spend time reading textbooks in that time. And obviously last month you do your revision. We'll come back to it again when we discuss it in detail. Now we'll discuss about the approach in dealing with short subjects. I'll start with forensic because that is one of the most high-yielding subject. There is a book by Sumit Sethi, Review of Forensic Medicine, which I think all of us must have read. And that book, seriously, if you read that book like 5 to 6 times, and that seems like a lot, but that book is a small book, a short revision, and if you read that 5 to 6 times, it's hardly possible that you would not be able to answer any of the questions of forensic in the AIIMS paper. And this is my personal experience. I've taken the exam in November and in May, and all the questions I could answer from that book. And it is a very high-yield subject because there's not much to think, that there's not much to conceptualize in that. If you know it, you can answer it and you will save time in the paper. So please read forensic well. If you are having your breakfast or if you're doing something on your laptop or on your phone, just keep reading 2-3 pages of forensic. This way you'll finish the book 3-4 times and it will settle in your head at a subconscious level where it would be easier to recall in the paper. So this is one subject which I would say which people might not give much attention to, but leads to 5 to 6 straight questions in the paper, and that might give you a lead over other people. About the other short subjects in the third prof, we'll start with the medicine wale subjects, derma, psyche. Dermatology, obviously the images are important. There are certain subjects in which images are extremely important, and derma is one of those subjects. You can, our textbook was Neena Khanna, and Neena Khanna has a very good thing that every topic has, or every chapter has a synopsis in front of it. So you read the synopsis, you see the images, your chapter is done. It's a very nice way to finish the entire Dharma with concept, not just ratification or seeing the images and remembering what it is. And not just that, if you're reading a topic, you can please use internet now that it's so easily available. You just open it on Google, you write the name of the disease and you'll get 100 images. Okay, so you can easily correlate if you're not able to correlate with the images in the book. Regarding psyche, there are people read psyche in different ways. Some read it from the textbook, some read it from the notes. if you're making your base for psyche, obviously you need to read your textbook for the first time, because obviously psychiatry is an important subject and it is a conceptual subject. They'll usually give you a case scenario which can be for schizophrenia or mood disorder or anxiety disorders. These all disorders obviously are very important. Child psychiatry is extremely important, ADHD, Rett syndrome. So certain topics which we'll discuss later are extremely important in psychiatry. So you read these topics from any book whichever you've been reading in your MBBS, and you can revise it from your coaching notes. You must have attended, even if you have not attended any coaching, you can revise from any notes, because psyche is an easily doable subject and in a very short period of time. You do not need to give a lot of time to psyche. You can give a short time, do the questions, because obviously a question based approach in psychiatry personally I think is easier, because that would give you a head start to the case scenarios that can be present in the examination. Surgical short subjects, ENT. ENT again, from the last 2 to 3 times they've been asking a lot of images in ENT. So please make sure that you see certain images, the instruments, like the things that you see in postings to be seen in ENT, because obviously angiofibroma, juvenile nasal angiofibroma, and certain topics like laryngeal cancer, and these all cancer per se for all subjects is becoming extremely important. But certain topics are obviously important in ENT, which you should read from Dhingra or any the textbook that you've been referring to. ENT is not one of the subject which has many questions being asked from the subject. There are 2 to 3 questions, so do not give a lot of time to it, but it is again high yielding. So if you've seen the images, if you've seen the instruments, if you know that what are the procedures like direct and indirect laryngoscopy, rhinoscopy, so again procedures and operations again important for all the subjects that you're doing, because they are being asked more and more so in the upcoming years. And remaining ortho, I personally just did ortho from Apurva Mehra sir's book and then notes. You would not believe this, but I've literally just revised the short booklet that sir gives, and there were 2 questions in the May paper, Anderson classification and Needs classification, both of them directly from one table from those notes. So that's really easy. Ortho is not one of the subjects that we read extremely in detail, but if you know basics of obviously osteomyelitis, the cancers and TB, which are the 3 basic things which you should know in ortho, and plus along with that the other topics can be done just from the review book and the notes, and literally you just read that. It takes 2 to 3 hours to read that entire booklet. You revise that, your entire ortho is almost sure ready that the question would be from those notes. So that is what I did for ortho. I guess, and Ophtha, definitely Ophtha. Ophtha is becoming more and more important. There was a time when there were 2-3 questions from Ophtha. There was even a time like 1.5 years ago when there were 10 to 12 questions from Ophtha. We do not know that how many questions can be asked in Ophtha, but again, Ophtha is one of those subjects where images are extremely important. Retina ki sari images, please see those ARMD, hypertensive, diabetic, cystoid macular degeneration, everything, all the images are extremely important. Cataract is important, glaucoma is important. Again, you do not need to go in the depths of these subjects, because that will take a lot of amount of your time, but it might not lead to that much yield in the paper. So Ophtha is one of those subjects. I personally read Utsav Bansal's Soch, a review book. It's a pretty good review book, and I also referred to Vineet Sehgal's notes in that. Obviously dark room procedures in Ophtha, extremely important. Again, as I mentioned earlier, procedures for all the subjects are extremely important. Please look at the genes also of cataract, of certain congenital hereditary disorders. They've been asked even in AIIMS exam and PGI exam, and they might be repeated again. So genes dekh lena for cataract. Even medicine subject, anesthesia. Anesthesia is one subject that I read, Ajay Yadav. It's a good book, it's a textbook, and you'd like to read anesthesia from that book. Again, questions in anesthesia are more important, because there is a comparison between all the gaseous anesthetics and the intravenous anesthetics, which they usually ask, that which of the following can be used in a neurosurgical patient or a cardiac patient, and you would have to compare between the 4 anesthetics that has been given to you. So for that you need to do questions. Even if you just read the anesthesia, you would not be able to answer that question unless and until you know that you've done certain questions where they were compared, and you've seen at tables where there is a comparative, which of the following can be used in, which is a very common question in anesthesia. Anesthesia equipments, extremely important. Instruments including Ryle's tube, endotracheal intubation, laryngeal mask, the anesthesia machine, all of them are extremely important. There definitely going to be one question in every single AIIMS paper where they asked regarding the use of any of these techniques in anesthesia and ICU care. So please look at the different types of LMAs on your internet. Please use internet as much as possible, and try to look at the images, try to look at the which are the positions in which anesthesia equipment should be used. So again, anesthesia ICU care very important when it comes to procedures and instruments. We'll also talk about radio. So radiology now is being asked in a very clinical manner. They don't ask directly radio questions. Radio May, they ask questions in which there is a clinical scenario given. So whenever you're doing any subject, try to make a radiology correlation with that, because obviously that would make it easier for you. If you're reading respi, then you do questions which are based on respi radiology. If you're doing cardiac, if you're doing if you're doing pediatrics, so pediatrics ki radiology you can see regarding what are the CDHK, the intestinal obstruction, the very common X-rays, the very common, up to they're even asking CT images, MRI images, PET CT images, diffusion weighted, all of them they're asking directly images. So please see the images of all the newer radiology techniques, all of them, because they can directly ask this is the disease, what can be the expected X-ray or expected CCT in this scenario. So please do that. And I don't think there is one particular book for radiology which you can refer, because as I said, it is related to all the different subjects, so you need to do radio. Obviously when it comes to radiotherapy, please read a little part of radiotherapy regarding the amount of radiation that you give in different cancers, because that has been asked and might be asked, because that is the upcoming branch in radiotherapy, because those questions cannot be answered by logic. You might look at it and you can say probably that this is pulmonary edema, but you cannot give what is the what is the thickness of lead that is required to stop the radiation. Such things are probably questions which are direct information based, and this has to be read. So please read the initial part of the radiology, all what increases contrast, what increases the penetrance. These all questions are direct information based questions, and they can directly ask this. Something regarding nuclear medicine also, a little basic regarding what are the what is used, FDG is used or not, what are the upcoming substances that can be used for this. So these all questions are newer questions, and they can put, and AIIMS has a tendency to put such questions in the paper. So that is all regarding radio. Coming to the long subjects, pathology, medicine, physiology, three of them are all connected. So please do the graphs of physiology, because they are very important, and they ask concepts. This time also they asked a concept based question in physio, and same is with path and medicine. Definitely you don't, if you are in your internship year, you do not have time to read the textbooks again, which includes Robbins, Harrison, but if you've read it in your MBBS, very well and good, because that would make it easier to do your questions now. If you've not, it's alright, but please make sure that you use these subjects not in wasting time, but in doing topics which are extremely important. Medicine mein, what I did was just revise Thamim's notes, because those are the most high yield notes I've ever come across. It encompasses the entire medicine, which is one of the most vast subjects, in 100 or 200 pages ka notes. So you can do that if you've attended that or taken it from somebody. Obviously your concepts of medicine should be strong, and that can only be done when you've done certain questions of medicine. Just reading medicine won't do, and this applies for all the subjects for that matter. Please keep on doing as many questions as possible. Even pathology, try looking at as many hemat slides as you can, including all the anemias, all the cancers, all the leukemias, because extremely important again. Systemic path maybe not so important, but general path extremely important. And you can use any review book if you have, or you can just look through your notes that you've made, or you can just look through the images. All three of them are connected, so try even pharma. So all four of them can be easily done. Pharma mein, please make sure that you see all the newly approved FDA drugs, because there can be a direct question from that, as it was this time, and it's like you can answer it and you would not waste time on that, and it's like you will take half an hour to study those. So, and pharma mein adrenergic drugs, anti-glaucoma drugs, certain topics extremely important. But always whenever you're studying, please combine physio, pharma, path and medicine while you're studying. It would make it much easier, would not require any repetitive study, and you'll be able to do it in one go and in a shorter period of time. So I think that is there. And surgery, again, trauma and breast, two most important things while you're in general surgery for that matter, while you're reading surgery. GIGO surgery, you can give it a read, because obviously it's not that you should completely ignore any of the topic, but trauma, please, please, please read as much trauma as you can. You can read wash manual, you can read your notes, you can read any updates that you have. You can please read Bailey ke updates from anywhere, from any coaching notes or any notes that you can find, because there is new Bailey's upcoming edition has come and there are a lot of changes in that. So probably AIIMS paper can come upon that. And breast cancer, one of the most important topics in the entire surgery. They'll directly ask you a question from breast cancer, probably from staging, probably from treatment, probably from any investigation. So read that while you're doing surgery. Obs and gynae, obs a little more of basic, because basic is required while you're doing obs. Gynae cancers, definitely. Gynecology cancers are extremely important, especially cancer cervix. And obs may please look through the examination of obstetrics. The basics of labor and the basics of obstetrics is much more important than treatment of diabetes and hypertension in obstetrics. So please look through that. And pediatrics, two most important things, neonatology and development. Those are must do's. And I forgot to tell you, in path, blood transfusion, one of the most important topics in path, because there is definitely going to be a question from blood transfusion. So please look through that. About the resources and the books I used, obviously if you're in your MBBS, then there is nothing better than standard textbooks. Do not, while you're in your MBBS, while you're in your first, second and third prof, do not replace your textbooks with your review books, because textbooks give you something that review books can't. They will give you concepts before giving information, before giving you knowledge. So definitely standard textbooks. If you finish your MBBS, then textbooks do not play a huge role, because obviously you do not have time, and time is rank when it comes to internships. So please use your time wisely. You can use, there is not one review book that is superior to another, obviously, but there are certain review books which will be suitable or considerable to you, and you use that review books for doing as many questions as possible. Internship is all about doing the important topics, high topics and questions, and taking tests, definitely. So resources that I used, as I mentioned in my subjects that I did, but one thing that I forgot to mention is first aid. First aid is a book which is usually used for USMLE preparation, step 1, but as far as it comes to AIIMS paper, first aid is extremely important when it comes to first and second prof. You can read biochem from first aid. You can add whatever you want about your class notes or your review books that you've read in that. So because the most important thing in PG preparation is revision. If you know where to revise from, what topics to revise from, it would be much easier. So please add as much as you can in your, and try to make it as concise into one book as possible. So first aid helps, because there are 6 subjects of first and second prof in one book. You can add from different books in one book, and then you can prepare for it from one single book. So I personally used it for micro, I used it for biochem. Anatomy not so much, pathology yes, even a little bit of psychiatry. So you can, it is up to you if you find it comfortable or not, but yes, there are certain things in first aid which make it much easier to prepare and a concise way to revise at the end. Obviously, you can use your coaching notes or other notes that you've made as other resources. There is no end to the resources, but you need to find the resources that can help you revise at the end, because revision is the most important key to success. I think we have discussed the important topics for first prof, second prof and third prof, but I'll still add certain which we did not add earlier. Anatomy, please look through brain case sections. They literally directly ask and to name the any anatomical structure in a brain. So please look through the images of that. Anatomy is again a vast subject, so you need to be very concise in what are the only important topics. Again, embryology very important, brain neuroanatomy very important. Certain things you can leave, that includes whatever you did in your first year, like which muscle, where is the origin, where is the end, and these all things are important during your MBBS. Obviously you should read them, but as you come in your internship, as you try to revise these topics, try to cut certain things which are not important when it comes to taking a paper, and that can only happen if you've done past year ke questions. So please do past year ke questions, whichever exam you're targeting. Doesn't matter if it's AIIMS or PGI or JIPMER or NEET, whatever, but please do past year ke questions. Physio, I think we've discussed. Biochem we've discussed. Biochem mein again DNA, RNA very important, and all the vitamins and minerals, B1, B2, A, C, D, all of them are extremely important. There is a question they'll directly ask from enzymes and amino acids, vitamins, and definitely DNA, RNA, transcription, translation, nucleic acid. All of this is extremely important. but again, biochem should be kept as principle. It's not a subject that requires a lot of amount of your time. Obviously, it's a subject that needs to be remembered, so try repeating. Certain subjects need repetition, that includes biochem, because you'll forget it as soon as you've done it one time. So coming to pharma, again, drugs you need to remember. There are certain drugs that you need to remember, but if you have a strong concept of pharma, sympathetic, parasympathetic drugs, then it should be fine. Chemotherapeutic and anti-cancer drugs, again, becoming extremely important. Micro, please do as many images as you can. Please see through the images, ova, cysts, blood agar, all the agars, all the microscopic images. Please see that while you're doing micro, and focus more on fungus and virology when it comes to topics, because again, they are becoming they are repeating in exams of AIIMS once again and again. Role of coaching in question banks, I think TND should suffices when it comes to coaching, because your foundation should be built on your textbooks. Your questions can be because you do not know the new upcoming questions, you have not taken the paper, so it helps if you've attended a TND, because they'll give you an idea about the new questions or the new topics that are being discovered by the professors who make the paper. So again, I cannot emphasize more the importance of solving questions, because as it comes near the end, theory becomes less and less important and questions become more and more important. Obviously, that does not mean you keep doing questions, but there should be a scheduled amount of time in your entire day where you just do questions or tests. And question banks, as I mentioned, as many questions as possible, especially in conceptual subjects, even in information based subjects, questions are extremely important. But after you've read your theory, please do not start with questions. You've read your theory, you've made a base, you do certain questions, you did not find certain questions that you knew, so you go back to the theory and make that theory stronger. I think it should be anterograde and retrograde, both combined approach. That would make it easier for you to solve the question. Coming to grant tests, extremely important again, because grant tests not only test your knowledge and concepts, it tests your time management skills, it tests how you switch from one subject to another. There is one pharma question, then there is one psychic question, there is one medicine question. So your brain needs to adapt to the surroundings. Your brain also, obviously, you'll realize with grant tests where you stand. And as far as grant tests are concerned, when you're in your internship, I would suggest that improvement should be the goal rather than rank in the earlier stages, because if you are at a certain stage, you do not wish directly for the 3rd rank or the 5th rank or the rank in the top 10. You wish to go a little ahead with every grant test. Obviously, your goal should be to become the best, but improvement should be the goal with every another grant test. While you're doing a grant test, you'll realize that there's certain topics, there's certain subjects which are given more importance to, that will help you study in a manner which will be more exam oriented. So grant tests are important, but tests become more and more important towards the latter part of your preparation. Obviously, in the initial part, theory is more important. In the middle part, questions become more important. In the end part, tests become more important. So keep that in mind while you're preparing for an exam. While preparing for PG, motivation is obviously one of the things which is, keeping yourself motivated is one of the most difficult things. But you need to realize that overthinking leads to depression, and that is a vicious cycle. Please do not think while you're studying. Just study and enjoy what you're studying. Study in a very focused manner. Do not get affected by what people are doing on the internet, on various social media groups, what people come and tell you regarding what your preparation is. Obviously, you need to be smart enough to realize that there are certain things that need to be, if somebody is reading some topic and you realize that this topic is important, you take the positive thing out of it and read that this topic can be important. You do not take it in a negative manner thinking, oh my god, I did not even realize that this topic was important. So please do not get negatively affected. Positivity attracts positivity. Please keep your head in a very positive manner and try to take it one day at a time rather than 6 months at a time. That you have an exam in 6 months, but you have a schedule for 6 months. Make a macro plan and then make a micro plan. In a macro plan, you need to know that there are 20 days for a single subject. That this is 1 month, I need to finish 3 to 4 subjects in this, and this 6 months, and then the last month this way. That is your plan. But while you're making the plan for an individual subject, try to take out topics from the past years. Try to make a list of the books, the resources that you have, the topics that you need to study before you start studying. You need to be extremely clear in your head before you start your preparation. Haphazard manner only increases chaos in your head. Keeping yourself motivated all the time is obviously not possible, but as much as you can, do not get affected and keep studying. There is no exception to hard work. Please, and your luck is made by your hard work, so keep working hard and keep yourself motivated. Talking about my strategy in the last 15 days of the exam, your last 15 days depend on the year before that, the 6 months or the year before that. If you've made good notes, then your last 15 days are going to be extremely easy. Try to make your own notes that this is what I'm going to revise from anatomy. These are the, and try to keep a book where you've written page 67 of this book is extremely important. When on the last day you're revising, you can go and directly see the page 67 of that book. You will be done with that topic and you will not have to refer to things here and there. So in the last 15 days, you initially start with the bigger subjects because those are the ones which are conceptual. Even if you've not revised it, in the paper the logic and the concept does kick in from, and it's not just about those 15 days. In the paper it's about everything from remote to recent memory. So you do the conceptual subjects first, and in the last around week you do subjects in which it is completely information based. For example, forensic, for example, pharma kit drugs, enzymes required in different reactions in biochem. So there are certain things which you are bound to forget by the end. If you've not revised it in the end, for example, even if you've read it 3 to 4 times in the paper, you'll be confused between two options. You'll be able to rule out two, but you'll be confused between two options. But if you've revised it at the last, you'll waste very little time on that question, which is anyway easy, but it was just your revision that was lacking. So again, I'm repeating, revision is one of the most important keys to success. Last 15 days depend on the early 6 months, but last 15 days, do not give up hope, do not get stressed, but definitely revise the most important things, and the last week, the information and the things which are need to be rectified so that you can directly vomit it out in the paper that you are going to take the next week. The most important things is how to attempt the paper. These 6 months are not going to matter if those 3 hours do not go well. So the most important thing is to sleep properly the night before. So if you want to use your brain logically, analytically with all of the remote and the recent memory, please sleep well, please have a nice breakfast and then go to the paper. And while you're in the paper, keep yourself calm. If you do not get the first question, it's alright. Go to the second question with the same calmness. If you cannot answer the second question, go to the third question with the same calmness. So please make sure that you do not try to get into the chaos that I could not answer 3 questions, now I'm done. It's alright, they were probably those 3 questions which you do not know, which followed by 10 questions which you did. But just because of the confusion and the chaos of those 3 questions, you're going to spoil those 10 questions which you would have done correctly. State of mind in those 3 hours extremely important. Keep looking at the timer, time and again, like after every 25 questions you're going to see the timer, that if there is some discrepancy then you try to increase your pace in the paper. And obviously do not spend more than a particular amount of time on a particular question. Every question has the same amount of marks. So if you do not know this question, if you spend that much time in it, you're going to make other questions suffer. You let that question go, you come to the next question. So that is how you attempt the paper till the last. Keep your cool and keep your calm. Coming to PGI, personally, I mainly targeted AIIMS exam, and so there is only a week left while you prepare for the PGI exam. If you are if you're actually targeting PGI from the first, definitely do the past year ke questions, because there is a very classical pattern when it comes to PGI. The entire pattern is different. There can be one correct answer, there can be 5 correct answers. But if you've done as more and more questions possible, you'll get the hang of taking the paper. Because in PGI, it's not just the knowledge, it's how you attempt the paper, which is also more important. If you are targeting AIIMS and if you have only a week to prepare for PGI, just the past year papers, not just the questions, past year papers are important. That will give you as to how many questions to attempt, how many options to attempt, because for all practical purposes it's 1250 questions, So, there are a lot of questions, so time management is also an issue. So when it comes to PGI, there are certain topics which are almost classically asked in every second paper, so you need to know the topics and you need to know how to take the exam. You cannot work by elimination in this as you would have done in a normal paper. So you need to know the topic thoroughly to answer that question, but you also need to know how to take that paper, for which you must have done the past papers. So if you're particularly targeting PGI, try doing that from the initial phase or the 6 months or the year that you have while preparing for PGI. I think if you're a PG aspirant, there are 2 things that are important: smart and repetitive study, and trying to take it one day at a time. Repetition, revision, extremely important. I'm trying to emphasize that since the first thing that I've said. And if you do not revise it well, it's not going to end well, because it's not just about knowing, it's not just about information, it's not just about concepts, it's about taking a paper, which is a slight, there is an, along with that, there is something that is, there is a smart study, there is a skillful study that is required while you're taking the paper, along with just knowing the subject. So please keep that in your mind while you're reading a subject. Reading a subject in MBBS is slightly different from reading a subject in your internship, because you are now targeting an exam. So it should be read in a very smart way regarding the questions that can be asked in the exam. You do not need to read the entire subject or the entire topic, but just what is more important. And you do not lose hope, you do not, you need to keep yourself positive while you're preparing for the exam. Obviously 6 months, 1 year, 1.5 year, 2 years is not a small amount of time, but that is going to decide your life and your branch for next 50 years. So obviously I would say it's a very small sacrifice when it comes to deciding a career in your entire life. So please make sure you do not give up, you constantly keep working hard, and all the best.